If you are currently on a Cigna Medicare Advantage plan and live in the state of Florida, I have some important news to share with you during this upcoming Medicare annual election period. Cigna, one of the biggest names in the Medicare industry, is not renewing some of its Medicare Advantage plans with the federal government. This change could impact up to 6,000 people in the state of Florida. So if you have a Medicare Advantage plan with Cigna, you want to keep a close eye on your mailbox for this change notification that you should be receiving any day now. Each year, all Medicare Advantage companies are required to send an ANOC or annual notice of change. This just simply lists changes to your Medicare Advantage plan for the upcoming year. Unfortunately, most people do not pay attention to this letter because they're happy with their current coverage and throw it away. This year is different. Definitely look for that letter because it could come in the form of a non-renewal notice instead of an annual notice of change. And as a reminder, the annual election period runs from October 15th through December 7th. That is when you are going to want to find a replacement should you receive notification of your plan not renewing. Hi, my name is Mark Pripp, and I've been helping people understand Medicare and the complexity of the system for over 15 years. Today I want to share with you some of the information that we're seeing coming down from Cigna and how it pertains to certain states that have the Medicare Advantage plans. Take a look at this statement I pulled from an article that Healthcare Dive did on the Cigna changes. Every year, Cigna Healthcare Medicare evaluates service areas for viability, network adequacy, and provider engagement, the notice says. If any gaps are identified in these areas that cannot be resolved, it can result in Cigna Healthcare reducing these service areas and or not renewing the plans. All of the information I provide in this video, I'll put a link to the description so you can read the full articles. Why is this happening? Cigna is not able to sustain the medical loss ratio or the claims amounts on these certain areas of the country that people have their Medicare Advantage plans. Cigna, along with all Medicare Advantage companies, receives a reimbursement rate from the federal government for every member they have enrolled. When they receive that amount, that helps them maintain the plan, set up the network, pay the claims. So they're receiving that money from the federal government, and then they're paying a lot out in medical claims when you use your plan. We're seeing this happen all over the country. It's happening with Aetna, Cigna, Humana. 2025 is going to be very turbulent for the Medicare Advantage space. Companies are claiming that they're spending too much in medical care versus how much they're receiving from the federal government. So what they're doing is they're looking at smaller areas where plans are struggling to be profitable, and they are choosing to not renew those plans. And unfortunately, in this video, it really is heavily weighted on the state of Florida. Seniors in select areas of Colorado, Florida, Illinois, Missouri, North Carolina, Tennessee, Texas, and Utah will lose access to at least one Cigna plan next year. Meanwhile, Cigna is exiting 2 counties in Missouri and 1 county in North Carolina. The reductions will affect roughly 5,400 members, mostly in Florida, according to the notice. That's about 1% of Cigna's total Medicare Advantage membership. Now, in all of those states I listed, it doesn't explicitly say that they'll be losing plans or not renewing. It just means they'll have less Cigna plans to choose from. It looks like the all-out reduction is heavily focused on the state of Florida with 5,400 members, potentially more being affected. Here's some advice I can give you. We've been in the Medicare space for 15 years teaching people about Medicare, helping them select the right plan. This is not new. This comes as no surprise to me, unfortunately. Companies have been flooding the Medicare Advantage market as baby boomers age into the system to try to get a piece of the pie, basically. A lot of companies are finding that they overextended their reach or they put too much emphasis on it, and with the medical loss ratio, their profits are not in line to be satisfactory for their stockholders. You have really 2 avenues avenues, and I'll tell you how to be prepared. Let's take a look. If you are losing your plan and you want to keep a Medicare Advantage plan, make a list of your doctors and hospitals and medical providers. When you do your list of prescriptions, make sure you get the correct spelling of those prescription names. We all know prescription names are very wonky sometimes, and the correct dosage. This way, when you go to try to find another plan, let's say you're looking at Florida Blue or United Healthcare or whomever it may be, the key information is making sure that the new company will cover all of your existing providers in network, and that all of your prescription medications will be covered on that new company's formulary list. So again, make a list of those medical providers and have a prescription list made with the correct spelling. Finding another Medicare Advantage plan in the state of Florida should not be a hard task. The state of Florida has the most companies offering Medicare Advantage plans. Now, here's a silver lining in all of this. If you lose your plan by no fault of your own, that creates a guaranteed issue right. That means if you lose a Medicare Advantage plan by no fault of your own, you can now enroll in a Medicare supplement or a Medigap plan. Those are two different names for the same plan. You can enroll in a Medigap plan and bypass medical health questions. Maybe in the past you've wanted to move to a Medicare supplement or Medigap plan, but when you go to apply, they have health questions, and maybe you have pre-existing conditions that prevent you from getting that Medigap plan. They deny you coverage because you can't pass medical underwriting. Well, this is given to give you a golden ticket, a guaranteed issue ticket that says, I've lost my Medicare Advantage plan, I want a Medigap plan, therefore I do not have to answer those medical questions. So this is an opportunity for you to get that Medigap plan if it's something that you've wanted in the past. And again, remember, Medicare Advantage is more managed care with network and referrals and prior authorization. Yes, it's lower cost per month, but it does come with a rule book. When you move to a Medigap plan, you deal with no networks, no referrals, no provider dispute between the insurance company and the providers. You will not deal with this government reimbursement rate like you are with Medicare Advantage when you're on a Medigap plan. And last but not least, probably the most important thing is when you move to a Medigap plan, you no longer have to deal with prior authorizations. All Medicare Advantage plans have prior authorizations. Medigap plans have none. Your access to care will be much faster, and there'll be fewer delays when you eliminate those prior authorizations. But again, Medigap plans come at a higher monthly cost, yes, but they are far superior coverage. If you do pick a Medicare supplement plan, you will also need to add a prescription Part D plan because Medicare supplement does not cover prescriptions automatically like Medicare Advantage. If you choose to pick a Medicare Advantage, have the information prepared. If you need a Medicare supplement, obviously you don't need the list of providers because Medicare supplement or Medigap has no network, so you can essentially go wherever you want. I hope that's been helpful. I hope I've given you some resources and information to be prepared should you receive one of these letters. Again, if you have questions, if you need help picking a plan, we're here. Comment below, call the number on the screen if you have questions, and we would be happy to help. Thanks for watching.